Are you ready?
Yes.
Okay. So yeah, so basically, the fluid, was probably about 1.5 inches in diameter. It was right next to your appendix. We had talked about how on your CT scans on the July 13th and 18th, the appendix was dilated and probably secondarily inflamed like the rest of your colon from this flare-up of ulcerative colitis. And so there's no way to know for sure, but it's probable that the pus came from the appendix. And if that's the case, then we have to assume that the integrity of the wall of the appendix is disrupted. In other words, there's going to be a leak somewhere in the wall of the appendix, which by definition would be called a ruptured appendicitis. And so the drain is taking care of the abscess. I think now you can expect the antibiotics are going to take care of this process. How long we'll leave the drain in? Probably till early next week. Just wouldn't want to pull it out too soon and have it redevelop. Then, of course, you could go home with the drain once
Right.
you feel like you're ready to go home. And then the issue that is going to have to be decided down the road is, and this wouldn't be something you would consider for a couple of months at least. You'd want to give it a couple of months to heal down there. The question to decide is whether to eventually have your appendix removed. And I think you could make a strong argument for that because the problem is going to be there's going to be a risk of this happening again. And so, normally I remember doing a literature search a couple of years ago for routine appendicitis. They used to think that when you had appendicitis and it ruptured and it was treated with a drain, they used to think in the old days that you would have to go back and take the appendix out, but then they looked at the literature and the risk of a recurrent appendicitis was actually very low. It was less than 10%. But the problem is your situation is so different because you've got ulcerative colitis involving the wall of the colon, and that's probably what caused the appendix to become inflamed because the appendix is a little structure on the wall of the colon right where it begins. And so, with your risk of having recurrent flare-ups of ulcerative colitis during your lifetime, to me, I think it makes a stronger argument. There's going to be no way we can go to any research paper or textbook that's going to tell us what your statistical probability of this happening again is, and so it's just going to be a decision that you have to make. But I would think it would be definitely higher than that it could come back again. So, I'm inclined to think probably you should have it removed. It's a very similar operation to the keyhole surgery for gallbladder surgery.
Right.
We do it through keyholes. You would never do it now because there's so much inflammation. Now your chance of having to be cut open would be pretty substantial.
Okay.
But I'm talking about doing it more as a prophylactic thing down the road to try to prevent this from occurring. I don't have a strong feeling on when you're discharged. I think it's pretty much at this point when your medical doctors feel comfortable with that from a surgical standpoint. The drain's been placed. I can follow you as an outpatient for that. We'll definitely want to keep you on the antibiotics for another week. But from that standpoint, you can follow up with us in clinic next week. So I don't have a reason to keep you in the hospital beyond when you and your medical doctor feel ready to go.
Okay.
But we definitely want to see you back in the office next week.
Okay.
In our practice, so we can make a decision about removing the drain, and we'll have to show you how to do the drain.
I got a phone call yesterday from your office reminding me of my 11:30 appointment today.
Oh, really?
I don't think I'll be there.
That's bizarre. It must have been set up last week.
It must have been after Dr. Lionel did the initial.
Yeah, it must have been
cleaning up of the
Must have been. Yeah, and probably just have you follow up with him since he's already did that procedure also. You could just talk to him about it. But basically, all you'll do is get the drain removed when you come back to the office.
And that's just a simple yank it out. So
pretty much, yeah, it really is. Yeah. So I'll ask the nurses to flush it today with some saline. That would be.
Will you also be who removes the PICC line?
The PICC line, the nurses do that when you get discharged.
Oh, okay. They had made it sound like I would.
PICC line's easy to remove.
Have it for a while.
I don't know. I'm okay with you being discharged on oral antibiotics.
Okay.
Yeah, I don't think you have to be on IV antibiotics.
Okay.
Once you're discharged. So.
Good.
Okay, cool. All right. Hope you have a good day. The wound's
Thank
doing okay.
you.
I don't necessarily have to take the dressing down. I'm assuming.
It's actually it's very sore today. It was wrapped a little roughly yesterday and kind of like jerked on.
Yeah.
So it's pretty sore.
Okay. All right.
Overall, still better than
Yeah.
I had been.
Okay. All right. Hope you have a good day.
Thank you.
If you need us, just
Hope
let
you
us
do
know.
too. Thanks.
Okay.